Hi, this is Dr. Albert Mensah, and welcome to another Mensah Medical Moment. I call this one the missing link. For you ladies out there who've had difficulties with both premenstrual issues, fibromyalgia, chronic fatigue, as well as anxiety and depression, you may have been labeled as being estrogen dominant. But what you may not realize is that both your physical issues and your cognitive issues are actually related. The commonality might reside in high levels of copper. Copper in the system is the missing link because copper is sensitive to estrogen. And so when estrogen levels rise, copper levels will also rise. But when copper rises, it wreaks havoc in both your brain and your body. Painful uterine contractions, heavy bleeding, chronic fatigue issues, menstrual migraine headaches, in fact, migraine headaches in general. All of these and many more other pieces to the puzzle are actually linked by copper. What's different here is that we have to evaluate the commonality, that missing link, and then look to treat it. It's not that you've been exposed to high levels of copper, it's that copper is built up in your system over time and it hasn't been removed. It's as though you don't have enough garbage men to clear out the garbage in your city. But instead, this garbage gets very toxic very quickly. So it's not in your head. It's not a matter of emotions. It's not a matter of, well, you just have to deal with it for the first 2 weeks of your cycle and then things resolve. Many young ladies have a very difficult time understanding that, first of all, they are not alone. And secondly, that these things are treatable. You don't necessarily have to be on an oral contraceptive to be treated for this. As a matter of fact, oral contraceptives can actually make the underlying cause worse. So I want you to understand that the next time you're wondering what's going on with me, why do I have both these physical symptoms and issues involving depression or anxiety or even postpartum depression, that there is a common link. The missing link here is understanding copper toxicity. One of the best parts to this understanding is that we don't have to use pharmaceutical agents. We don't have to use drugs. We don't have to use injections. We don't have to use any of those kinds of modalities to actually treat the underlying cause. There are perfectly natural remedies that lead to resolution, improvement, happiness, and peace of mind. I'm Dr. Albert Mensah for Mensah Medical Moment.